Good morning, everyone, and thank you so much for tuning into your Sunday edition of Wasatch Weekends. We've got a great show in store for you. We're going to be giving you a lot of information, whether it's the VA and anesthesiology, or whether it's talking about vaccines and how you can stay up to date on all of them as an adult. And then we're going to be giving you some great banking information on why it's so interesting to involve technology in the way that you bank and how it's really helping people and maybe hurting people in the long run. So make sure that you stay tuned for the next little bit of Wasatch Weekends, but let's take a look at that local weather forecast right now. It's really important that as Americans, we take care of our veterans. Well, we're going to introduce you to two fabulous people who are going to give you more information on how you can help do just that and the involvement of anesthesiologists. So let's hear what they have to say. Welcome back to the show. I'm joined by two incredible doctors who are going to give us information on how you can make a difference in medicine for veterans. So I'm joined by Dr. Harder and Dr. Bush. Thank you so much for being here this morning.
Thank you for the opportunity, Maddie.
Thank you, Maddie.
Now, for people who maybe don't know who you are, can you guys just give us a quick introduction?
Sure. I'm Dr. Ron Harder, and I am president of the American Society of Anesthesiologists.
And I'm Dr. Bridget Bush. I'm a practicing anesthesiologist and a combat veteran.
Now, the VA has a proposal that's going to change the way that veterans would receive their anesthesia, from taking it from an anesthesiologist to a nurse. Can you explain a little bit more about this to us?
Certainly, and we think this is important information for our veterans to be aware of, and certainly all Americans to be aware of, that this proposal that the VA is considering would remove physician involvement with the delivery of anesthesia care to our veterans within the VA system. The model that's been in place for decades in the VA is physician-led, either the physician delivering the anesthetic themselves or directing a nurse anesthetist in delivering the anesthesia care. That's the model that's used in the vast majority of surgeries in the U.S., and it's used in all of the leading hospitals in the U.S. This proposal would remove physicians from the delivery of anesthesia care to our veterans, and frankly put our patients at unnecessary risk. Our veterans would be at unnecessary risks under anesthesia in the VA system.
And so would moving to the nurse-only model cut costs? Would it make access easier?
Thanks, Maddie. No, it would not. So the cost of anesthesia care is the same, whether an anesthesiologist or a nurse anesthetist is providing it. So this would not cut costs. It would not save taxpayers any money. Additionally, the VA's own data shows that there is no anesthesia workforce issues nor access issues within the VA. As a veteran and an anesthesiologist, I know the importance of teamwork, using everybody's different skills, strengths, and experience. And anesthesia is no different.
So what's the difference between an anesthesiologist and a nurse who would be practicing the anesthesiology?
Yeah, thank you. That's an important distinction for Americans to be aware of. An anesthesiologist is a physician who's attended medical school, residency, and in many cases a fellowship following residency. They have twice as many years of education as a nurse anesthetist, and they have 5 times more clinical hours of training than a nurse anesthetist. And beyond that, just the types of things that they are learning is significantly different. Anesthesiologists are trained as physicians to understand and be able to diagnose, manage, and treat medical issues before, during, and after the patient's surgery. Nurse anesthetists are terrific nurses, but they simply are not trained to be substitutes for anesthesiologists. Their training is to be an important part of the team, but under the leadership of a physician.
And so what happened in 2017 when a similar change was proposed?
Thanks, Maddie. Actually, in 2017, finalized an extensive multi-year review by the VA. They talked to key stakeholders and elicited public comments, got an astounding 200,000 public comments to the Federal Register, including 50,000 from veterans and veterans' families. And after all of this review, they really looked at the evidence and said that there is no reason to change the model as they had it, and maintained physician-led care. At this time, nothing has changed that would make it reasonable or necessary for them to put our veterans at risk.
Now, what can people do to help protect the safety and the health of our veterans?
Yes, thank you, Maddie. We would ask that every American go to safevacare.org, where they can learn more about this risky proposal that the VA is considering. And it also provides them with an opportunity to submit comments to their legislators who can reach out to the VA leadership and express their opposition to this unnecessary and risky proposal. There are pieces of legislation in both the House and the Senate in the U.S. Congress that would strengthen and clarify maintaining physician leadership of anesthesia care within the VA. So that's an opportunity for every American citizen to help to support those pieces of legislation and to help the Congress to message the importance of this, maintaining the level of care that's currently in place within the VA for our veterans.
And one more time, what is that website, just so people can look it up?
Yes, safevacare, all one word, .org.
I want to thank you both so much for taking the time to chat with us, and thank you for all the hard work that you're putting in for our veterans. It really does make a difference.
Thank you so much.
Thank you, Maddie.
Make sure that you check out that website. That way you can get all the information and have all of the knowledge. That way you can help make a difference for our veterans. We're going to take a short break, and when we come back, we've got more of the show, so stay tuned. I had a chance to sit down with 2 incredible women to talk about why vaccines are so important and how they can make a difference into your adulthood and here in your community. Let's hear what they have to say. Welcome back to the show. A great way to help keep your community safe is stay up to date on your vaccines. I'm joined by 2 fabulous doctors who are going to give us some more information on why this is important. Can I ask you guys to introduce yourselves and your roles, please?
Absolutely. Good morning. I'm Dr. Candace Robinson, and I am the Director of Scientific Affairs and Public Health for U.S. Vaccines at GSK.
Good morning. I am Dr. Liz Moyer. I am the Director of Patient Care Services at Albertsons Safeway.
Which you guys do, Albertsons and Safeway does a lot of vaccines because people can just walk right into the pharmacy and get them. And so why is it important for people to keep up to date on their vaccines?
Yes, vaccines are one of the most powerful tools we have for protecting ourselves against vaccine preventable diseases. In the US alone, 16 diseases are now preventable due to routine vaccination, starting in childhood and through adulthood. So this includes flu, RSV, measles, and chickenpox, among others. Vaccines greatly reduce the severity and toll of vaccine preventable diseases across our lifespans. For example, each year, the flu vaccine prevents more than 3.7 million influenza-associated medical visits, that's visits to the doctor, to the ER, and more than 100,000 hospitalizations. And some of the most dangerous diseases have been virtually or completely eliminated thanks to vaccines like polio and smallpox.
Which is so important. And so for doing the standard routine care, maybe everyone knows to go get their flu shot when it's that time of year. What other vaccines can I get as an adult?
Yeah, so while certain vaccines, such as flu, are administered during the fall and winter months, other vaccines, such as pneumococcal, RSV, shingles, HPV, and hepatitis vaccines, can be given at other points during the year. So it's really important that you talk to your healthcare provider, your doctor, your pharmacist about what vaccines you need to ensure protection against vaccine preventable diseases all year round.
And how do I know that a vaccine is safe and effective?
Yes, like all medicines, vaccines undergo an intensive review process by the US Food and Drug Administration, or FDA, and its outside advisors. And they really evaluate the safety and the efficacy, or how well that vaccine protects. Further, the CDC's Advisory Committee on Immunization Practices develops recommendations for US immunizations, like the ages at which vaccines should be given, the number of doses, and the time between doses. And finally, after they are approved for use, biopharmaceutical companies, the CDC, and FDA continue to closely monitor the safety and efficacy of vaccines.
Now, what questions should I or anyone ask their local pharmacist before they get a vaccine?
So it's just important to know that your pharmacist is a community health partner. Most Americans live within 5 miles of a pharmacy, so they're very accessible and a great resource. So you can call them at any time or walk on in and ask questions, ask what age, based on your age, what vaccines you should get. Or if you have certain disease states, there may be vaccines that you should get. You can ask about side effects and any other concerns that you might have, such as can I get more than one vaccine at a time? So the sky's really the limit, and your pharmacist is there to support you and provide you with more information.
And where can I go to learn more information about the vaccines?
Absolutely. GSK has a resource called EasyVax, and that's one word spelled EASYVAX. And it's a mobile vaccine scheduler that will allow you to quickly locate and schedule routine retail vaccine appointments from anywhere, including at the provider's office at the point of recommendation. So please visit EasyVax at easyvax.com. Dr. Moyer?
You can also visit safeway.com/pharmacy or albertsons.com/pharmacy, depending on where you're located, and get more information about the vaccines that are available, schedule an appointment, or you can obviously always walk into any of our pharmacies at any time. So you can learn more there as well.
And how do I know if I'm in need of a new adult vaccine? How do I know if I'm up to date on all my vaccines?
Yeah, absolutely. That's a great question. A recent GSK survey found that many adults 50 to 79 are unfamiliar with the vaccines recommended for them, and providers indicate most adults are unlikely to receive many of the vaccines they recommend. And so it's really important to talk to your healthcare provider, your doctor, your pharmacist, as they may also recommend other vaccines based on your age, health conditions, and lifestyles. And when you receive a recommendation, going to easyvax.com to locate appointments in your area.
Now, this is all such great information, and it's really important that people do this not only to protect themselves, but to also help protect the community. Why is that?
Yes, vaccines are essential in helping prevent the transmission of viruses and in order to protect our family members, friends, and neighbors from severe illness, particularly those who are most vulnerable. So again, vaccines remain one of those most important tools to provide protection against vaccine preventable diseases.
I want to thank you both so much for being here, taking the time to give us all this great information, and thank you for maybe helping people become more aware of the vaccines that are possible for them to keep themselves and the community safe with.
Thank you.
Thank you.
Make sure that you check out these fabulous resources. That way, if you are someone who maybe has not had a vaccine in a while, you can see what you're missing. Talk to your healthcare provider and see if there's one that will help you be a little more protected out there. We're going to take a short break, and when we come back, we've got more of the show, so stay tuned. It's really important that you know what's happening with your banking, and there's so many different ways to bank these days, whether you want to go in person or whether you want to do it from your phone. Well, we're going to learn some tips and tricks on how you can practice better banking with Capital One. Now, we're going to talk about some literacy that you may need for banking, and especially if you're of the older demographic. So I got Adam Davis here joining me to chat about some of these great things. Good morning, Adam.
Good morning. Thanks for having me.
Thank you so much for being here. Now, you've done a lot of research on the literacy on banking and how seniors should really look out to protect themselves. So can you give us a little more information on what you mean?
Yes. We have two different things that we're looking at. One is whether you are digital literate, and that means that, today in a digital age when so many things are done online, like paying your bills or checking your account balances, can you do those things in a really safe way and avoid phishing or scams? And then there's the financial literacy, which is about being able to have a handle of the basic concepts to drive and improve your financial well-being by making informed decisions about your finances and helping you meet your goals. So we recently did a study that looked at this combination of digital financial literacy, which is your ability to do both. And we found that 86% of consumers are digitally literate, meaning that they can do these activities safely online. However, 40% of consumers lack the basic financial knowledge to do things such as managing their debt or improving their credit.
And why is it so important to be savvy in both places, in the digital and in the financial?
It's really important because you want to make sure that with so much stuff that is happening online, you are able to do it really safely. But if you're missing some of the building blocks from a financial literacy perspective, then you're going to not have as good of an understanding around what it takes to be able to meet your financial goals. One of the things that we found as we went through this is that seniors, those that are 65 years and older, have 3 times almost the digital financial literacy rate of those that are 18 to 24. And that biggest gap is financial literacy.
And you guys just ran a survey. What did the survey show as results for consumers and financially?
Yeah, so the survey was highlighting this opportunity around financial literacy where seniors are doing better than we might have expected, but 18 to 24 are lagging behind. So as a result, Capital One cares about arming consumers with the right knowledge, and we partnered with Khan Academy, spelled Khan, an online leader in online learning. And through that, we've developed free online financial literacy courses for folks of all ages to be able to really drive this online financial education.
Have consumers improved their digital skills when it comes to their banking?
They really have. 70% of consumers today use online banking or enrolled in online banking. And almost 2/3 of consumers today have a preference of managing their finances either through the mobile app or through online banking, whereas going into a branch is only the preference for less than 10%. So you're really seeing those preferences start to shift.
It's wild now that we have everything at our fingertips on our phone, how convenient it can be. And so if people would like to learn more information, or if they would like to take this online course, where can they get that?
Yeah, go to CapitalOne.com, search for Khan Academy, and you'll find information about the study and links to the courses.
Thank you so much for taking the time to chat with us, giving us all this great information. If you had to give someone one piece of advice right now to help them manage their money a little bit better, what would it be?
Take the courses and learn everything that you can.
Adam, thank you so much for being here this morning, giving us all this great information, and thank you for the hard work you're doing. That way people can improve not only their cybersecurity, but maybe they can learn more about how they're spending their money.
I appreciate it. Thank you.
Make sure that you check out this fabulous course online. You can go to CapitalOne.com, look for the course, and that way you can help improve the way that you're spending your money and everything that you're doing with your phone. That way you can bring the two worlds together. We're going to take a look at that local weather forecast right now. We want to thank you so much for tuning into your Sunday edition of Wasatch Weekends. There was so much great information for you to take away from this. I hope that you use all of these wonderful resources that we bring to you. That way you can continue to expand and learn. I've been your host, Maddie Evans, and I want to thank you so much for tuning in to your Sunday edition. We'll see you tomorrow.